अस्सलाम वालेकुम तमाम मेंबर्स। मेरा नाम है ज़ेहब-नबील और हमेशा की तरह वीकेंड पे आई एम लाइव विद अ वेरी स्पेशल गेस्ट। जैसे कि आप लोग हमेशा हमारे पाकिस्तान में या हमारी सोसाइटी में एक स्टिग्मा या एक थॉट रहा है कि वुमेन कैन नॉट मूव अहेड, उनके ऊपर बहुत ज़्यादा मसले हैं, दे आर बीइंग स्टॉप्ड, उनको सोशल स्टिग्मा है। बट आई ऑलवेज से कि ये हमारी परसेप्शन है, एंड इफ़ यू आर रेडी टू फाइट अगेंस्ट द परसेप्शन यू कैन बी व्हाट यू वांट टू बी। आज हमारी गेस्ट हैं Miss Saira. She was born in Lahore, but she was raised in Multan. And when she was raised in Multan, Multan was a quite different city, not as it is now. एंड उन्होंने वहाँ पे ही अपनी सारी बेसिक एजुकेशन ली। मुल्तान बहाउद्दीन ज़करिया यूनिवर्सिटी से उन्होंने अपना मास्टर्स किया साइकोलॉजी में। और आप इमेजिन नहीं कर सकते कि इन्होंने जब बहाउद्दीन ज़करिया यूनिवर्सिटी से अपना मास्टर्स किया, उस ज़माने में उनके पास साइकोलॉजी की क्लासेस तक नहीं थी। शी फॉट आउट विद हर कोलीग्स एंड peers and they collected charity and built a whole department on her own. They have literally raised the money to build the department in Bahauddin Zakaria University. So she's one of the women who was from Multan and he fought her way out. So I really want to say कि इस तरह के लोग भी हमारी सोसाइटी में हैं और literally society don't stop, it's you. आपकी thought आपके mind में होता है कि आपने आगे जाना है कि आपने रुकना है. And Saira fought for what she wanted and she was always been supported, as she's told me, and now she is where that she's helping people. She's a American certified psychologist and she is helping people to grow faster. I will bring her now on the screen without wasting any time. Assalamu alaikum Saira, कैसे हैं आप?
Walaikum assalam. I'm good, alhamdulillah, Zahib.
सबसे पहले thanks for accepting my invitation and coming live on Pakistanis in Alan.
Thank you for having me, Zahib.
Thanks for giving us time. That's more important. So Saira, growing up in Multan, getting a Fulbright scholar, ending up in USA, worked in USA, and then moving back to Pakistan, being associate professor, running your own consultancies, and all those things. How you made it happen? Can you give us a little bit brief about yourself first?
Sure, Zahib. I would say, it's just a matter of persistence. If I summarize it, looking back on all of those years and achievements, if we may. So if the journey, started all the way from schools and colleges in Multan, and then like as you shared, when I applied for Fulbright scholarship, I didn't even know the details. Like the word GRE was new to me back then. And I was able to secure that by the blessing of the Lord, and completed my master's then in New School for Social Research, came back, joined BNU, started teaching MS-MPhil Clinical Psychology, then started my own initiative as well. And I've been serving at a few prestigious universities back home as an assistant professor of psychology. So you keep your goal clear, you keep your focus at it, and it's never a smooth, easy ride. It is not supposed to be. So if the understanding is that the challenges will be there, and the idea is how do you face them, and how do you sort of tackle the scenario and move on. That's how it works. And even over here, it took me 2 years completing the whole process of equivalency and then sitting for the test during this COVID scenario and everything. So it took about 2 years to complete that process. And only in I guess a few months ago, I was able to get my license as a therapist, as a psychologist over here as well. So, yeah.
That's great. तो सायरा, आप कितने अरसे से प्रैक्टिस कर रहे हो यहाँ पे, मतलब ये ओवरऑल, और यूएई में कब से कर रहे हैं आप?
UAE, if I count all the years, 1 year in 2014-15, and now the 3rd year I started. So I'm in my 4th year in UAE. But overall, if I say, post-graduation, so all the way from 2009 to now, about 11 years.
That's great.
And it's a mix of clinical practice, university teaching, soft skills training. That's the combination I take, and I couple it always with first-hand research, so that it's not a copy-paste of what you learn from the West and try to apply to the East. So you understand people firsthand, not just as a way of having lived there, but like a proper research-based understanding, so that you're able to help them better.
That's great. That's great. तो आपके पास कौन से licenses और certifications हैं in terms of psychology profession?
I guess I'll try to give you a short list there, the ones that are relevant. So let me begin all the way from the master's itself. So the master's training from US as a Fulbright scholar. And since then, the idea has been, even though the specialization there was in motivational interviewing and substance abuse and mental health counseling was the track that I pursued, I've tried to stay informed and keep updating my toolkit since then. So let me try going there chronologically. So I even completed my specialization in CBT, while I don't readily use that particular methodology in my practice, but after motivational interviewing, that was there. Then mindfulness-based approaches, trauma-focused interventions, trauma-sensitive interventions, even narrative therapy, positive psychology, the clinical aspect of positive psychology. I'm even a certified, I have the specialization for traumatic stress studies. That's a 10-month program that was run, completed that in 2018. That's about the trauma survivors, the adult survivors of abuse, or adult survivors of people who come across trauma in various forms. We'll talk about details later on. I even have my specialization in EMDR and neurofeedback. Recently even tried getting a professional certification in hypnotherapy, and only recently I also completed rational emotive behavior therapy certification from Albert Ellis Institute, New York. So the idea is it's my job to keep my toolkit updated so that the right tools are used for the right sort of requirements that come up.
That's great. So usually आप अपने counseling goals किस तरह set करते हो? जब आप किसी को करते हो तो के success criteria आपका क्या होना चाहिए? How you define those things when you set up any session or any counseling goal which you think that you have to deliver?
It's since my approach is not directive, it's more of we work at the same level. So it's the client and the therapist are at the same level. So for me, it's a mutual agreement that we reach. So it's a simple question after you listen to the narrative, and once you've seen what the needs might be, instead of me assuming that these would be the goals, it's a mutual discussion that we hold with simple questions like, all right, so what would you like to work on actually? What is it that you would like to attain in the short run and in the long run? It's as simple as that, if I can say, not to sound simplistic, but it's something that we look at mutually and agree mutually to take it forward. And then, of course, based upon the list, it goes like, all right, so we wanted to work on this. This is maybe where we started from, and this is where we are, and then hence the progress.
That's good. How you describe your ideal patient? Like when you say these are the patients you love the most, or you want to counsel them the most, how you define it?
All right, so let me try addressing that, even though it's hard to refer the patient elsewhere sometimes, but my actually approach to it is I do a 10-minute session free of cost before I even move to the hour-long sessions. The idea is that there has to be a match between what I'm able to offer and what the needs of the clients are. So people that I usually work with are adult trauma survivors. They are people with depression or anxiety issues. It could be, substance abuse as well, addiction issues, emotion regulation in general, thought-related problems. So all of that, and when I say trauma survivors, a lot of the times you would only see them having erratic relationships maybe with people, or self-harming behaviors, or emotional regulation issues. That's the picture that you get. A lot of the times it's maybe I'm not enough. You see the needs in the form of complaints or thoughts that need to be addressed. I don't work with childhood psychopathologies. So if it's autism, ADHD, that's not my area. So yeah, that's the summary of it. That's my ideal patient. Also, I don't expect my patients to come with rigid commitments. So even if my patient, my client says that I am maybe smoking a pack of cigarette a day and I want to reduce it to 2 cigarettes a day, I welcome those people, because the idea is to have them have the empowerment of setting the goal for themselves. It's not for me to dictate. And honestly, what happens in most of the cases is when they see that how their quality of life has improved after reducing all the way from 1 pack a day to 2 cigarettes a day, or after like having anger outbursts several times a day to maybe once a week, they end up then choosing for complete letting go of that.
Got the point. तो by the way, जब हम लोग ये स्पेशली सोशल इलनेस या इसकी बात करते हैं तो ये ज़हनी बीमारी या मेंटल इलनेस ये बेसिकली है क्या? How you define it?
Let me try to begin a little technically then here. If you're talking about mental illness, we typically see it as 4 Ds, let's say. So क्या dysfunction है कोई कि जिसकी वजह से कोई ability affect हो रही है? Is it a deviance? Is it different from how people in general work? Is it distress? And is it dangerous either to yourself or to other people? So that's how, like, you know, the beginning of the understanding starts to develop when it comes to mental illness. And I'm not going to get into the technical critique here, but just to give you an overview, sometimes people go like, so if the deviance could be positive as well, right? What if you're way more intelligent than the rest of the people? So there are those aspects. But in general, when we say mental illness, it involves conditions that include some changes which aren't helping you with regards to emotion, thinking, or behavior. And this is different from mental well-being. So हम उसको in contrast to mental well-being भी देख लेते हैं कि it's about your thoughts and feelings, how you cope with ups and downs of everyday life. So like mental health then overall, it's a state of well-being in which an individual realizes their own abilities and can cope with like normal stresses of life. They can work productively and they're able to make a contribution to their community. And if that's not helping, that's a compromise that needs to be addressed.
That's great, very elaborative answer. One of the gentlemen asked, what is depression? Can you just tell a little bit about depression?
Definitely. Good question asked, actually, because what I like here is before I get to the answer, it's better to ask instead of stick to a misunderstanding that you might have. No question is a dumb question as a rule. If we start living it by, that will help us. So oftentimes depression is confused with sadness or stress and anxiety even. Lust depression जो है वो एक technical term है. It's a disorder, it's a disease, a mental illness that exists out there. And DSM, you know, the Diagnostic and Statistical Manual of Mental Disorders that we psychologists usually follow, it talks about depression in 10 symptoms, nine symptoms in terms of that. So 2 of those are like, you know, the universal. You need one of that for sure. But in simple words, depression is a state. It's a cognitive state. It's a sort of feeling state where you're not able to get pleasure out of any activities whatsoever. You don't feel happy at all. And no matter what you do, you're not able to fight it, like, you know, on your own. And then there are associated sort of symptoms with it. It can affect your sleep. It can affect your eating patterns. Some people sleep too much. Some aren't able to sleep. Some eat too much. Some lose their appetite. You start feeling worthless. Sometimes it leads to even, you know, suicide ideation. You want to end your life. You feel there's no purpose to life. You can either gain weight or lose weight. And a lot of self-questioning. So like, you know, self-esteem is damaged as well. You don't think of yourself as worth anything. And the most critical element here is that you believe that this is a fixed state. You think you cannot change, the world outside cannot change, and this is right here, right now, it's like this, and it will stay like this in the future. There's no hope. So that's like, you know, an overall picture of what depression looks like.
Got your point. By the way, when it comes to mental illness, is it something very rare a person can have, or a lot of people around us have it and they're afraid to talk about, or how you define it? What are the stats or numbers usually you come across, and how you find it or you define it?
Excellent question. And you know what? Let me answer it in a very connectable sort of a way. So instead of giving you percentages, if I were to say that mental illness is this common, that everyone knows someone with a mental illness. Everyone. If we look around, we ask people, they would know either somebody with depression or bipolar or childhood psychopathologies or addictions, alcohol, drug use, any of those, and the brain areas get affected in those pathologies. So these personalized numbers sort of make more sense to people rather than percentages. And one other way of looking at it is, I work a lot in the area of child sexual abuse and adult survivors of child sexual abuse. So when I say that 1 in 3 girls or 1 in 6 boys experience CSA, that's sort of more connectable for people. So 1 billion people worldwide experience some sort of mental illness at some point in their life. And if we think we don't know any people who experience mental illness, it shows a few things, actually. It shows a lack of an understanding and awareness of what mental illness is. It shows that we are reluctant and ashamed to admit it. And most importantly to me, it shows that mental illness is highly stigmatized.
Got your point. So when you say this, stigmatized, so stigma, basically, what is stigma?
So yeah, stigma literally means dishonor and disgrace. So there is a lot of shame attached to it. Let me actually do a thought experiment with our audience right here live. And for those of you who are listening now, let me take you to a workplace scenario. So imagine you're invited to your boss's birthday party, and you're the one who has been asked to, give that speech where you're thanking the person and wishing them and everything. And on that day, you get sick, and you know that you have to cancel. Now, when you make that call and you tell the other person that you won't be able to come, would you rather say it is because you have a kidney stone, or that you were depressed or suicidal? Would you rather say that you fell and sprained a muscle, or would you rather admit that you're having a panic attack? Would you rather say that you're having a migraine, or would you rather say that you're, on prescription pain medication? Now, if in each of these scenarios you preferred the first option, that means you're affected by stigma. So the brain, that is the primary basis for mental illness, it's 100 billion neurons approximately, 300 trillion connections, complicated neural circuit that forms, your personality and you as a person. So it's a lot deeper than that.
Okay, got your point. So usually what are the common misunderstandings when it comes to this mental illness and stuff? What you have faced while dealing with your patients or while dealing with the people around?
Good question. So I guess I'll begin with the typical words that we use to talk about people who are fighting with mental illnesses. Usually, people who are facing mental illness, who are fighting it, they're defined as lazy, violent, unmotivated. And let me contrast it with somebody who's battling cancer. We'll say he or she is strong, brave, determined, courageous. So it's almost perceived to be in one's own control, almost like saying you did this to yourself, you have to fix it yourself. So it's more like, imagine taking a child to a hospital with broken leg and the doctor says he broke it himself, he better fix it himself. So we even don't hesitate in using words like, in fact, this is very common, and the words only change from culture to culture, but the list almost looks like nuts, psycho, crazy, freak, wacko, screw loose, unhinged, maniac. In our culture, people don't even hesitate saying, especially for addiction, let me go there. So all the way from 𝘚𝘚-𝘊𝘚-𝘧𝘪𝘦𝘥, 𝘚𝘚-𝘊𝘚-𝘧𝘪𝘦𝘥, chersi. And all of that is derogatory and demeaning. It contributes to increasing the stigma. Ideally, we shouldn't even be using words like addict or schizophrenic, almost like saying a person with a fever, you're feverish, you know what I'm saying? So the right phrase is people with depression, people with addiction, or a person with mood regulation issues. So people say it because they don't understand mental illness in their true capacity. Mental illnesses aren't choices. So it's not like, you tell the person, snap out of it. What's wrong with you? So that's a common misunderstanding right there.
So Saira, when you say that mental illness is not a choice, so from where it comes from? Is it due to the society which bullies a person, or something happens in a society which make him mentally ill, or is it something which is defined in his biological DNA? It can be inherited, or how it comes from?
So pertinent. There isn't one cause of mental illness, but while we say that, we do understand that maybe there is something called biopsychosocial model. Another term for that is biopsychosocial spiritual model. That's the lens through which we can try to understand mental illnesses, because humans are complex. A lot of things combine to form a human, and then all of those variables, all of those factors end up affecting us as humans. So it can be any one or multiple reasons because of which a person starts facing a mental illness. So it could be, let's look at the first term when I say biopsychosocial spiritual. So the reason can be biological. It could be a disturbance in neurotransmitters or hormones. It could be a brain damage. There can be a chromosomal abnormality that leads to that. Sometimes, it's certain vitamins, like lower vitamin D can also cause depression. Serotonin's imbalance can cause depression, if we stick to that example. It could be a psychological reason. It could be the way a person starts perceiving certain scenarios that leads to a certain pathology. It could be the gender differences and expression of that. So if there's a stressor out there, let's combine the social aspect of it now. Let's say socially there's a stressor out there, and different people try to fight it differently. So if there is anger being generated within you, somebody like a certain gender or like a certain person might respond to it by having crying spells. Another person might express this by having anger outbursts. And there is a spiritual element to it as well. A lot of parenting comes into play. Sometimes harsh parenting, punitive parenting, jisme marna, abusive language, it's common. That affects individuals big time as well. And especially the early years are very critical. So if there is that sort of harsh exposure, even vicarious trauma, it doesn't have to be directly aimed at the child. A child who grows up observing too many parental fights or too much of a chaos or violence in the house, even kids watching it through media, that is also likely to affect them. And trauma survivors, if you see, they end up staying in that survival mode sort of a way throughout. You'll see them, reacting abruptly to stressors out there, because one thing that the brain is there to do is to make sure that you survive. So then for those people, the survival mode becomes the common way of operating in the world.
Very great, Saira. So, by the way, what is the people attitude towards seeking help? Because when we grew up and where we grew up, we always see that people are too much afraid to seek help, and they are not ready to accept mental illness as any kind of an illness. And even if you guide someone's parents or someone say that, okay, I think that this guy or this girl needs a help, they will say that तुमने मेरे बच्चे को पागल समझा है, तुमने ये किया है. So is this changing, or how it is impacting nowadays? Or is there any social cultural difference in this case? Maybe in subcontinent, people are not ready to seek help, but situation is different in UAE, and the situation was different in USA where you have done your graduation, or it's the same everywhere?
Let me begin from the last question that you asked. Unfortunately, I would say the stigma related to mental illnesses and mental health, it's almost universal, almost global. So save a few countries, a few select societies, a lot of places in the world, a lot of people in the world, they still hesitate reaching out for help. And one of the ways to understand that might be the whole lack of focus on the research and science for it. Like the more a disease or a problem becomes treatable, the more we see that the stigma related to that, the hesitance in discussing that gets lowered down. So treatment doesn't only eliminate the symptoms of the illness, it also eliminates the prejudice and the stigma related to that. And then within that, we see that certain issues or certain illnesses, they are completely curable, completely treatable, and certain illnesses are manageable. Like, you sort of live with them, but in a way that your functionality doesn't get too affected. So people are across the world, and of course, for sure, in the subcontinent, especially the Pakistani community, that we relate to firsthand and that we've also researched for a lot of years, a lot of hesitance is still there. People are afraid. People aren't willing to talk about it. And maybe the nature of the illness itself and the lack of understanding around that, it plays a part in it. So let me walk you through a few examples over here. If somebody has borderline personality disorder or symptoms which are close to, complex PTSD, the nature of the people, because you'll see them like, having mood volatility, self-harming behavior, stormy relationships with people, ekdam se, like, they are absolutely in love with someone, and then all of a sudden, cut the cord and like, move on, never talk back, things like that. These kinds of people, their nature, that pushes the people away from them. And they're like the treatment for these people, it's not easy peasy, it's complex. So even sometimes professionals are hesitant to take them in, and not all patients respond well. So the biggest barrier there as well is also stigma. Let's go to depression, or like, other mood related issues of the sort that fall into the category of illness. Research says that people show symptoms for about 7 years for mood issues or for depression before they get a diagnosis of major depressive disorder, let's say. And people around them maybe, or they themselves, don't notice it to a point that they realize that I need help, or it's better to, seek help right now. So they would be hurting themselves, they would make suicide attempts, they would sometimes do self-medication and maybe do, use drugs as a way of numbing or calming down whatever's happening inside of them. So typical reactions, even when it's noticed, is, come on, life has so much to offer, snap out of it, it's your job to make yourself feel happy, nobody else is going to come and fix it for you. And that's not helping the people who have mental illness be able to reach out openly. Talk about trauma survivors. Instead of intervening there and then, as and when the trauma happens, it could be a natural disaster, it could be an abuse incident, it could be domestic violence. We, as in general, we wait for the people to sort it out on their own until one of the persons, or like, some people reach a point where they have to go through the embarrassing process of them speaking up, because then it's on a relative note, then it's on a comparison note, that these are the people who were able to get out of it on their own, but then these are the people who needed additional help. Same is the case for addiction. So people who are, abusing drugs, it can even be cigarettes, alcohol, which are like in some cultures considered acceptable, but that's also dependence on those things is also addiction. So our job is to encourage them to speak up and support rather than name and shame. So if we are able to even accommodate people's request to lower the drug use, that will help them reach out for treatment. But because a lot of the typical attitudes, even when it comes to professionals, is either you commit to quitting, or we are not getting you in treatment, or we are just blaming the person, directly who's doing it. We are shaming them. That keeps them from reaching out. So all in all, if we make the process of reaching out easier, it will not just help release the emotional stress, but reduce the financial burden on the community as well.
Got your point, Saira. But when it comes to all these points, so how we can work as a society to stop the suffering, the violence, and the stigma around all this? Because as you said, that if it has been catched at the right point of time and right kind of help is sought, then things can be very different. A person can show symptoms for years and nobody will notice them, and later on when he get really infected or impacted, then we will make him like a useless part of the society or start considering him like that, unfortunately. So how you think that this can be stopped and how it can be catered?
True. To an extent, I would say that some of the pathologies lead people to commit violent acts later on. And the symptoms for those, they manifest like, long before they've committed the crime. They would be acting strangely, they would be socially isolated, emotionally disturbed, but nobody intervened. They were shunned, they were ridiculed, they were feared, but not helped. And oftentimes it's the other people who end up like suffering the consequences, and not just one person, the society then as a whole. So we gotta begin from realizing mental illness for what it is, and that it can be treated, it can be addressed, just like a lot of the physical illnesses out there. So if you see somebody choking, you'll rush and ask, like, is there any way I can help you? Why don't we do the same when we see somebody emotionally disturbed or intoxicated, even under the influence of drugs? Can we step forward and do that, what we need to do, which is be involved, show our concern? Can we not be afraid to ask, can I help you? Can we make it our business? Like, to be honest, what's the worst thing that will happen if we do ask? They'll say, mind your own business. They'll say, I'm okay, thank you for asking. But then what's the best that can happen? You may be able to get somebody to help. You may be able to help them, alleviate unnecessary suffering, and you can potentially save them from harming themselves or others. So we can begin as a community from our own selves, from our own houses, and then maybe, do the advocacy for the same, using our voice at our workplaces, in the communities, maybe have campaigns around them, because a lot of the people, when you ask them about breast cancer even, they would say they have been a part of a campaign, maybe they've gone out for a walk that was around breast cancer, but rarely would you see anyone saying that I, went for a walk or an awareness session on depression or suicide or anxiety or mental illness in general. And just to share with you, the one most important factor that helps people share openly and seek treatment and share with you that they need help is when they see that the other person is genuinely concerned. They care. And there will be no judgment passed when I share with them about the struggles that I face. When they will see that compassion is being extended my way. And if we can get from just hoping for things to be better to actually acting on them, I guess we're playing our part over there.
That's great. Saira, as per you as a person, have you ever taken any counseling yourself or any peer consultancy from your peers? Because no person on the earth can ever say that I've never again went into any kind of depression, any kind of a stigma. So have you ever been able to do that, or you ever thought of taking that, or you're lucky till now?
I would say I am lucky and fortunate, as the word that you mentioned, because I've experienced the life as the whole spectrum offers. Have my ups as well as the downs. It's, the whole set of the good things and the so not good things, the bad things, it's very much there. And our training actually, so I won't associate the word lucky and fortunate with not having problems. I have my plate full there, to an extent that I'll share with you that when our training begins as psychologists or as psychotherapists, one of the first things that we're asked to do is look at our own issues and our own problems, our own biases, and we enter therapy right away. So it's mandatory. It's not even an option then. But even later on, I have chosen to be in therapy to address my own issues, my own well-being concerns, my own biases even, and the right way of looking at the world, etc. So yeah, it's very much there. And I have no shame in sharing it out loud over here, because all that psychotherapy would do is, as long as, you know, it's good, efficient, effective psychotherapy with a well-trained professional, it can only bring you good. It can only benefit you, to be honest. So yeah, I've been in therapy, and I still seek psychotherapy sessions like every week. So every Saturday is my own therapy session, while I offer therapy to others online as well, you know, regularly across the week.
Got your point. By the way, as a Saira, as a person, if I ask you, what do you think are your strengths when it comes to counseling, or limitations as well, both?
Yeah. Good question. So as I shared with you, now, even when I say, all right, childhood psychopathology is not my domain, adult psychotherapy is like what I work with. So the lowest age I would deal with is 16, 17, 18 years, nothing below that. And then it's all adults, you know, you could be in your 20s, 30s, 40s, 50s. That's my client. So my specialization within that is more of like the trauma-informed approach or a humanistic approach. So if a client is in need of like, you know, very sort of hardcore directive sort of therapy, that's not me. I am more of empowering the client alongside me. So like the more of a humanistic approach over there. So I will never sound like an expert on your life. So when I'm in psychotherapy session, the power will still be you, and the idea is to empower you. And since I come from like the trauma-informed perspective, so I guess that's really where the strength lies, because a lot of the times the clients that I work with, they're not looking for, or what is not going to benefit is a direct practical solution. So they're not for that sort of advice. Like, you know, oftentimes it's a male-female sort of a conflict that comes up. So like one person is saying, oh, I'm struggling with this, struggling with that. And the other person, usually a male, would offer an advice that solves the problem there and then. And they go like, all right, so we did our job, but this person still feels not listened to or not understood. So that's where the strength lies on my part, because I understand that that person is not looking for a practical solution right away. They need the emotional healing before we can move to the practical problem solving. So if that part is not taken care of, no matter how many solutions are offered, it's not going to heal the person from the inside.
Got your point. Usually, like one typical session, how does it look like? What kind of things are usually discussed in these kind of sessions? Do you try to ask more about person perspective, or you try to, you know, as we say, that try to intrigue certain concepts in the mind of a person, or how does it work? Usually a session, how it works?
A session, Sahib, is usually 1 hour long, all right? And since most of the times mental illnesses are like, you know, an accumulation of so many years of happenings and so many things happening in your life around you as well as inside you. So you begin from trying to connect with the person, trying to understand where they're coming from. That would include understanding the person's, you know, their personal, professional, social, educational history. But I don't do the usual typical intake. So like my first 2-3 sessions won't just be paperwork. So it's more like doing the psychotherapy alongside the intake. So it's done like side by side, so that the sessions are effective right from get-go. But once, like, you know, the initial few sessions, which are sometimes all about client trying to give a narrative, sometimes it's a lot of like, you know, emotional healing that's happening there. And then the sessions like, you know, the 4th or the 5th session, they might be a little different in nature as compared to the first few. So there you could be like, you know, setting goals like right at the beginning of a session and then addressing the same within that. And oftentimes I tell people like, you know, and it's like, you know, something that sometimes people have a hard time understanding, that no miracles are going to happen in one meeting only. But progress for sure will happen in 1 or 2 or 3 meetings as well. But psychotherapy, the approach that I use, usually requires a series of meetings, so that when you think of healing, or like, you know, when you say that, okay, these and these issues have been addressed, they should become a part of who you are. So then the same reactions, let's say, would come out naturally. So right now, if you're reacting to every stressor, then the therapy has to be ingrained enough, the change has to be deep enough so that you become a different sort of a person once we say, all right, we're good to go now, we can terminate the treatment.
Got your point. Usually an average number of sessions per patient, like how you see it, like usually it takes a certain number of months or number of sessions. What is an average, like where you see that the patient is good to go?
Varies from person to person, from issue to issue. If it's like, something that can be dealt in a short-term manner, the frequency, I can tell you for sure, it's once per week. That's how the meetings are. The sessions are 1 hour. And if it's something like, you have anxiety or the worry issues related to one particular event or one particular theme, you will see that 10 to 12 sessions would be more than enough to reach a point where you can say, all right, we can terminate treatment now. But contrast it with maybe a trauma survivor who's having maybe complex PTSD, which is different from like, just the PTSD where like a lot of emotion regulation, a lot of your living patterns have become a certain way. So that's not taught in terms of just weeks. It requires maybe a longer interaction over time.
Got your point. And the patient privacy is one of the major things which you have to take care in your profession, definitely. But
I can comment on that actually, because Zohaib, very well, privacy, confidentiality, very important points. And a lot of the times people hesitate, especially, I won't want to say it, but especially trauma survivors, like people who have been, maybe who have faced childhood sexual abuse and now are like adult survivors, or maybe people who are into drug use, highest level of stigma attached to those areas. And we don't leave aside anxiety, depression, self-esteem, worthlessness issues either. A lot of people don't speak up, don't reach out for professional treatment because they're scared of being judged, and they're scared of that talk going out of the therapy room. So that's one thing that, at least from my side, as I say, I offer individual psychotherapy, I offer group psychotherapy from a Voice of Wellbeing platform. That's one thing that I'm very cautious of. A lot of the times I've chosen not to work with certain established facilities out there because I saw compromise in privacy and confidentiality at their end. So that's something that I'm very mindful of, because I can see it happening firsthand, because I seek therapy as well. So those would be the first things that I look at as the first thing. Will I be judged for saying what I say? Will this stay here? And yeah, I hear you.
got your point. So Saira, being a woman, do you have an advantage over your male peers, or what? How you feel it? Because I feel that the female survivors or they will feel more comfortable reaching out to you, or you feel it's vice versa in general practice?
I think I hear you there, Zohaib. Maybe from the client's perspective, they might feel more comfortable reaching out to me. But I would want to shed light on maybe other people out there. My understanding of what makes people reach out to you is once they believe that you have genuine care for them and you will not be judged for what you think, what you do, what you believe, and you as a therapist are capable of offering genuine compassion, I think those factors are more critical as compared to the gender of the therapist.
That's great. That's exactly I wanted to listen.
It is what it is, Zahib. It is what it is. So not looking at or not focusing too much on the negative aspect of it, but we know professionals like, who don't do that, or we think they don't do that. So it's more about those skills, do you have the human alive in you while you're the professional?
That's true.
Is it just like,
That's great. So Saira, have you ever faced any difficulty of what you are today to be, because anybody in your life who criticize you, or you think that you are here today what is Saira Munsaf Khan is today is because of the help of your parents, society, how it happened. Did you ever face any resistance, or it was all the help of your family?
Combination of both. This is more of a disclosure moment here.
Yeah.
My family wasn't even all for the Fulbright scholarship when I got it. But I would say that things have evolved so much over the years that my younger sister also got Fulbright scholarship, and right now she's pursuing her PhD. And they are all support, not just for her, but for myself as well now. So that's an evolution that I've seen happening at my siblings and parents' end. And alhamdulillah for that. If I could take a bit of a credit there for initiating that, and Lord's blessings. So yeah, a lot of barriers, a lot of difficulties en route, but then a lot of support as well. And one thing that I would say, that keeps you going as a person in society, because a lot of the times I work with people having complaints of their parents, or they're angry with how things are. I think what keeps people going is when they see the evolution in the parenting happening at the end of the parents as well. If it is it was what it was and that's it, you got the best of it, that's where the hopelessness starts to kick in. So as long as things are progressing, as long as you're able to make that impact, not just in the society at large, but literally around the people around you, it's positive feedback for self, to be honest.
That's true. By the way, definitely parenting is changing. We couldn't imagine to do certain things in front of our parents, but our kids can do them in front of us without even thinking twice.
And even as parents,
Yeah.
you could maybe relate to it. You
Yeah.
might be one kind of a parent 5 years ago, or 3 years ago, and today you would have evolved. You would have used, you would have realized that, oh, if I use this strategy, that might work better. And that's the whole idea. As long as we are updating ourselves, as long as we are open to improving ourselves, that's as best as it gets.
That's true. Actually, one question came while I was talking to you, and it's been asked that how I know that when I need to seek a professional help, because we suffer with depressions and anxiety on the daily basis in our life. So when we are able to say that no, it's really a problem, we need to go and seek a professional help, I think it's a good question to answer.
And it will require self-awareness. It will require reflection at your end. The moment you see that this emotional feeling, and I can almost sense this is coming from that emotional disturbance end, the moment you see that this disturbance right now, it is affecting me internally to a level that it is compromising my ability to enjoy life, or it is affecting my work somehow, it is affecting my social relationships somehow, it is keeping me from reaching my goals, it is keeping me from being able to do things as I want to do them. All of those are red flags, which if you're able to sort of welcome them and register them, don't hesitate, feel okay reaching out for help. Sometimes that feedback can come from people around us as well. So instead of being defensive every time people say, I always hear you say so and so, it could be a negative set of thinking, it could be a reactionary sort of behavior that people are trying to inform you of, it could be your addictive patterns. So people who are important to you, people that are close to you, when they give you that sort of a feedback, I guess that is also one of the things that if we start welcoming and reach out for help, it can help you in a very timely manner. It can sort of solve the problem before it gets worse, if I may.
That's great, Saira. Thanks. It's a very great answer. So, Saira, what kind of an advice you want to give it to the community in general and the people who want to adopt your profession? Like what they need to do and what is the good in this profession? Because I feel that the beauty of your profession is that, okay, you are making your bread and butter out of it, but at the same time, you're helping the community. And this is kind of a fulfillment, people like me, we are into a very different technology business, but in our spare time we try to do some volunteer work just to get that kind of fulfillment. like we are doing something for the community. But for you, your profession makes you to feel that all the time. So what kind of an advice you want to give it to, especially to the young generation who are choosing the fields, they want to choose what they want to be. So what's your say on that?
Sahib, while these were very pertinent examples that you quoted with regards to you and me, maybe, I would say it's a part of emotional intelligence. I say that, like, when I'm giving talks on, or like workshops on emotional intelligence as well, it's important to know where your passion lies. It's actually a skill, being aware, being self-aware to a level where you know what is it that causes me happiness, on the inside, what is it where my passion lies, what is it that I enjoy doing to an extent that I can do it for the rest of my life. It's important to know that, and it is okay for that to vary from person to person. Somebody might have that feeling of flow, as we call it, or that contentment coming out of some lab work, or it could be finance work, or it could be other sort of science work. It could be, humanities or art, or some other social sciences as well. And that's just fine. Because if I were to speak about counseling, psychotherapy even, let me tell you, it takes a certain level of emotional resilience and empathy as well. So imagine, like, being in sessions day in, day out, and multiple sessions every day. So even when it comes to this profession, while it is helping other people out, it is not for everyone. So you would see people burning down. You would see people who are not able to draw those emotional boundaries, or who are not able to exercise that emotional resilience, or who don't even fit with this sort of a profession, but maybe have the degrees backing them up. So you see what I'm saying? There has to be that fit between who you are as a person, who you are as a professional, and what you're offering. So, yeah.
I got your point, Saira. Before leaving or before ending the session, I just wanted to ask you one more question, because you used one buzzword, which was emotional intelligence. It reminds me of an artificial intelligence for which I work for.
Okay.
Do you think the time will come when these artificial intelligent engines will take over the role of the counselors, or all these kind of roles, because people will feel more safe talking to someone whom they know is a machine and cannot leak out the information? Or you think the human touch will always be required? What's your perception of that? Or it will aid you in the future, or it will take away the job? What do you think?
Already happening, Sahib, already happening. We see like a lot of apps out there. Maybe it's not happening to a level at which you have asked the question, like would it replace the counselors altogether? I think you can tell that better. I can only tell you what's required of a counselor or a good psychotherapist, and then maybe a person from your background can tell us, can we hit that level? Okay. Now, applications are already there. So like there are a lot of applications that are used for, like, addressing anxiety or depression and stuff. And a lot of IT usage is already helping us, even to do assessments at times. And like I offer my practice is online itself. So I'm using IT right there as well. But when it comes to usage of artificial intelligence to a level that you have, like, you have the counselor in that virtual mode itself, I don't know, because would we be able to replicate humans? Like, are scientists right now in a position where they can literally recreate a brain? All I know is we are not there yet. There's something you might be interested in. I think you can explore it on your own. It's called the Blue Brain Project. So we're trying to understand brain layer by layer, slice by slice. Let me give you an example. So to date, we don't know how memories are stored literally. So like, can you tap into a place and say that, okay, so this particular incident is written over here? That's not how it works. So we know which areas are responsible, like which areas are the memory storehouses, but do we understand how they're, like, sort of written over there or pulled out from there. That layer by layer understanding, labs are, scientists are working on it. And if we reach a stage, we are able to understand the complexity of the brain and the complexity of a human to a level where we have written everything code by code, then maybe we have the stage set for that.
I got your point. I don't want to comment much on that from the technology perspective. There's a small question before. I'm sorry that I told you that this is the last question, but it just came in.
Can I actually add something before you get to the next question? Now, and I want to hear your take on it, to be honest, because then because I come from a non-tech background. I'm a psychologist. The best we get is like the scientific backing or the understandings related to the brain. So we ask questions like, can robots write a poem? Can robots, and just recently, I think we came across something that was an artificial piece of writing written by a robot. So a lot is happening.
Yeah, even the painting has been done by a robot recently. So things are improving.
So we're making progress.
Yeah, we are going there.
Yeah.
Actually,
so if I see that coupled with the Blue Brain project, if both of them couple.
Well, see, a lot of research is happening, but I firmly believe, and I agree with you, one thing, that there is no replacement of human in the end. Maybe roles will change. All these technologies will be helping hand. As you know that back in early 90s, when Industrial Revolution came in USA, people were afraid that we'll lose our job and blah, blah, blah. Things have changed. Actually, we created more jobs in the end. It's the same shift which is happening. Artificial intelligence will be there. Yes, it will replace certain jobs, but it will produce alternative jobs. And it will be, again, a help to the society. So it's the same kind of an advancement. Nothing will change in the end. That's what I feel.
और साहब कॉम्प्लेक्सिटी इतनी ज़्यादा है ना, आपने मुझसे शुरू में आई थिंक किसी एक इन्होंने पूछा ऑडियंस ने कि डिप्रेशन क्या है, तो मैंने आपको बताया कि एक तो वो जो 9 सिम्टम्स की लिस्ट है उसमें भी या तो वो ज़्यादा हो सकता है या कम हो सकता है, या इधर जा सकता है या इधर जा सकता है. फिर द मल्टीपल थॉट्स दैट आर रिलेटेड टू इट. सो ये इतना कॉम्प्लेक्स है कि हम लोग अब लेबल्स पे जाते ही नहीं है. So you and I both could be having major depressive disorder, and we could be absolutely different people out there.
That's true. That's true as well.
इंसान बड़ा complex है.
The most complex machine in the world.
Yeah.
The question is actually, depression or trauma, does it have any relationship with the mental growth in people as well? That's what's been asked by 𝘚𝑚𝑎𝑡 Tanveer.
Mental growth से क्या मुराद है इनकी यहाँ पे?
I can't answer that basically
because that is exactly what it impacts. हम ये तो है ही, हमने बोला कि conditions क्या हैं, कि depression जो है वो affect ही आपके emotions, thoughts and feelings को कर रहा है. So mental well-being जो है वो ही impact हो रही है. इसी तरह trauma, especially जो लोग traumas face करते हैं. So let me give you a direct example of somebody who is probably like, let's say, a childhood sexual abuse survivor. So when they face chronic sexual abuse, and we're talking about a child here, like, when you're in your critical years, जबकि अभी neuron connection, brain development अभी हो रही होती है, because इंसान एक ऐसी species है कि हम दुनिया में इस form में आते हैं कि अगर हमारा ख्याल ना किया जाए तो हम survive नहीं कर सकते. And probably the only species. The rest of them come prepared. They could have parents or not have parents, and that's fine. With humans, that's not true. We need somebody. It can be anyone, but we need somebody to take care of us in order for the human to survive. और काफ़ी साल जो है वो काफ़ी कुछ develop होता रहता है. Neuronal connections जो हैं वो जिस तरह से, like, you're not really formed completely when you come to the world. और शुरू के 5-7 साल खास तौर पे they are very important for social emotional development. तो अगर उस टाइम पे कुछ भी traumatic events हो रहे हैं, and if we stick to the example of childhood sexual abuse, your brain wiring would be working differently then. So yes, वो जिसको आप mental कह रहे हो, वो mental, and like you go down to the core, वो brain level पे उसकी wiring जो है वो इस तरह से बदल जाएगी कि instead of your frontal or executive functioning being the predominant response in times of stress, उस शख्स का जो सर्वाइवल मैकेनिज्म है लिम्बिक सिस्टम लेवल पे, वो एमिगडाला के थ्रू होके फिर सब इंफॉर्मेशन चैनल करेगी और वो फॉरन सर्वाइवल मोड में चला जाएगा. सो अगर आप मेंटल ग्रोथ की उस सेंस में बात करो तो you'll see कि those people would like become really aggressive in regular stressors. आप हो सकता है उस सिनेरियो में उसको कामली डील कर रहे हो, आपको कहें कि हाँ परेशानी है, but that's it, we'll manage. That person, उसके लिए वो जिंदगी मौत का मसला बन जाएगा. Why? Because back then वो उसके लिए जिंदगी मौत का मसला था. So literally the brain wiring changes, and hence you can't just ask people to snap out of it. और फिर सिर्फ talk therapy नहीं होती इसके लिए. मैं आपको इस पे भी explain कर दूं. When I use the word कि जी my training is trauma informed, तो वो सिर्फ गुफ्तगू नहीं है वहाँ पे. There are even approaches that I'm trained in that don't require you to talk, because oftentimes one of the hurdles that people have, क्यों वो therapy में नहीं जाते, because उनके लिए उस चीज़ के बारे गुफ्तगू करना इतना मुश्किल है कि they would rather keep suffering to themselves. So then professionals like me, we're even trained in ways to address it, to have psychotherapy, to offer psychotherapy without having those elaborate narratives in the therapy session.
That's great. Thanks a lot, Saira, for your time. To all the viewers and the members of Pakistanis in LN, just to tell you, Saira is also running a Facebook page, which is Voice of Wellbeing. Link has been shared in the comments and in the description of this post as well. अगर आप में से कभी किसी को भी कोई mental help या कोई इस तरह की चीज़ चाहिए हो, you can always reach out to her through that page. As she told during a session कि उनका एक way है, she don't take everyone, but she always provide like 10 minutes kind of a session in which she chooses and you choose as well. It's a a mutual decision of both sides. Like if you like the way or her approach, or she likes or she can help you, because हम एक बंदा हर बंदे का इलाज नहीं कर सकता. Every person has a specialty, so she need to judge you and you need to judge her. But again, please never abuse the facility of 10 minutes free session. If you are really if you're really requiring a help, you can reach out.
Sahib, let me add another offer here.
Yeah.
I'm actually running, besides psychotherapy, individual psychotherapy to hai hi, I'm running a group psychotherapy starting the first week of October. और वो सिर्फ एडल्ट सर्वाइवर्स ऑफ चाइल्ड सेक्सुअल अब्यूज उनके लिए है. सो जिन लोगों के साथ कोई भी सेक्सुअल अब्यूज या एक्सप्लॉयटेशन का इंसिडेंट हुआ हो एज किड्स, उनके लिए ये एडल्ट्स, अगर अभी आप 18 साल या उससे ऊपर आपकी उम्र है, तो सैटरडेज को फीमेल्स के लिए, सो UAE टाइम इट विल बी फ्रॉम 6 to 7:30, और संडे को मेल्स के लिए UAE time it would be again 6 to 7:30. Separate groups are males and females. और ये सेशन Zoom के थ्रू हुआ करेंगे, और उसमें आपकी प्राइवेसी इस तरह मेंटेन रहेगी कि I would be the only one who would know कि who you are. आप डिफरेंट नाम से ज्वाइन करोगे, वीडियो नहीं होगी, टेक्स्ट बेस्ड रिस्पॉन्सेज होंगे सिर्फ. एंड इट्स अ 6-week program that I offer. उसमें coping, emotion regulation, self-care will cover the whole domain for like well-being of the trauma survivors. So if you're interested in joining that, do let me know. You can contact me directly through the Facebook page as well. And I guess I'll request 𝘉𝐻𝑒𝑚 to share my WhatsApp number there too. And you're more than welcome to join that.
Sure, I will do that. I will share your WhatsApp number as well. Thank you, Saira. Thanks for your time. Thank you, everyone. Thanks for being live with us and seeing us and having us. And hopefully have a nice weekend. जितना भी रह गया बाकी सबको जुम्मा मुबारक हो. Take care. Assalamu alaikum.